So, COVID-19 is a respiratory disease that can cause severe illness, especially in people with pre-existing health conditions. Now, with the Omicron variant now being locally transmitted, a lot more of my friends are worried about getting the infection from an infected individual who may be asymptomatic. So, as a result, I know a lot of my friends and relatives have already resorted to testing using a home kit antigen test instead of getting a PCR so that this result can help them decide what they need to do if they become positive for COVID-19. And for those who are wondering, what is this rapid antigen test? Can you use them also? And how accurate are they? Let's watch this. We all know that the most vulnerable nowadays to COVID-19 remains the unvaccinated. And these unvaccinated people are more prone to severe illness than the vaccinated, that usually results in severe disease requiring hospitalization. But everyone agrees that breakthrough infection also continues to happen among friends of ours who have been vaccinated, even among those who were given booster shots. But I am here to remind everyone that vaccination and booster actually do not really make people invincible to infection, but it does its work, which is simply to keep us from developing severe disease requiring hospitalization or intensive care unit. Therefore, try not to blame the vaccine if you get infected. Instead, assess, where did you forget to wear your mask, and where did you expose yourself to some friends who may have been asymptomatic but are already infected. Now, at present, there are two ways to identify the current infection of COVID-19. We know the gold standard for diagnosis is the RT-PCR test that can help diagnose COVID-19 by detecting the genetic material of the coronavirus. However, it is more expensive and takes time to do and needs an accredited lab to do it. But there's a second type that most of my friends are now doing because it can be done at home, and it's called the rapid antigen test. This test actually helped diagnose COVID-19 by searching for certain molecules found on the surface of the SARS-CoV-2 virus. Now, what is important with this rapid antigen test is that they can provide results in as little as 15 minutes and really don't require lab analysis. So what usually done is during this rapid antigen test is that a cotton swab is inserted into the nose and throat, both to collect mucosal cells. But it's very easy because its kit will provide you with the steps to the procedure, and then a sample is then applied to a strip that will give you changes in color that will tell you whether you are positive for COVID-19 or not. At present time, there are several of these at-home tests available nowadays, being sold in increasing amount because of the Omicron surge. But remember, these rapid tests aren't as accurate as the gold standard RT-PCR test. So these home COVID-19 tests have a higher chance of giving you a false negative result, meaning it's more likely that the test will indicate that you don't have COVID-19 when in reality you are infected. So in this study published in JAMA, researchers found that within days 0 to 12 of symptom onset, the home test correctly identified 78% of people who did have the virus and correctly identified 97% of people who didn't have the virus. Now, it is best that when these tests are taken within 3 days of symptom onset, they can actually correctly identify 96% of COVID-19 cases. These researchers found the test taken 3 days after symptoms appeared were almost as accurate compared to the test taken the day the symptoms started. In fact, some of these home-based rapid antigen tests are sensitive enough that they can actually catch roughly 85% of people who are infected with the virus and can only miss 15%. Remember, these tests are more sensitive to people with symptoms than without, and are most sensitive during the first week of symptoms, as antigen testing becomes more reliable during this period because there's more virus to capture in the sample. Now, here's some good news. These rapid antigen tests rarely give you a false positive result. It is when you test positive for COVID-19 when you don't actually have the infection. So likewise, the rapid test correctly identified positive COVID-19 result in 99.6% of people. So what then can we do? If your rapid test shows that you don't have the virus, but you have symptoms of COVID-19, it's possible that you received a false negative result. It is therefore a good idea for these groups of people to confirm your negative result with a more accurate RT-PCR test. In this case, most likely because you have symptoms, you have COVID, and therefore I would recommend you treat and isolate yourself. If you have the information on hand that you are positive, then these antigen tests are very excellent at flagging people because a positive test means you have a high viral load and therefore most likely to be actively transmitting the virus to others if you don't isolate. So here's a very simple rule of thumb. The more virus you have in your nose, the more virus you're breathing out into the air, and therefore the more virus you allow others to breathe in and be infected. So these rapid antigen tests can be very accurate and in itself can allow you to make better decisions and decide the best option, like isolating yourself right away if you get a positive result, which for me is a very powerful contribution of this rapid antigen test to prompt decision making. Now, here are some tips on how to make use of this home rapid antigen test. Remember, these are good options for people with symptoms, and they can take this test immediately at home. If you have a known exposure to the virus through a friend or relative who called you because they are COVID positive, then those exposed should probably wait 3 to 5 days before doing the test, because testing too soon before the virus has had a chance to replicate increases the odds of a false negative. Rapid antigen test again works best when they are used serially. If you tested negative after a possible or known exposure to the virus, or after initially developing symptoms, you should take a second test, preferably at day 5. The Centers for Disease Control in the United States recommends that all those who have been exposed, the best practice would also to include a repeat antigen test at day 5 after exposure to really end your quarantine period. Remember, these rapid antigen tests are highly specific, which means that they generate relatively few false positive. So if you test positive, don't go into denial. Instead, right away, isolate yourself, monitor your symptoms, and seek medical care if necessary. It is best also that the consumers who are testing locally or at home should also report their positive results to their local health authorities. Let me share with you a simple guide that I find very practical and easy that you can easily screenshot later for your records from the government of South Australia. If you are a close contact or you have symptoms and your rapid antigen test is positive, there's really no need for you to get a PCR. Or if you are a close contact, even with no symptoms, you don't need a PCR if your rat test is negative. But if you're a close contact and you'd have symptoms and your rapid antigen test is negative, then to confirm if you're really truly negative, you get an RT-PCR. Or if you have COVID-19 symptoms but no known contact, then the rat is negative. You still have to get a PCR to confirm your COVID-19 infection. If you have no COVID-19 symptoms and no known contact and your rat result is negative, then that's basically it. There's no need for a PCR test. But if you have no COVID-19 symptoms and you have no known contact and your rat result is positive, this is where a positive rat, you may need a PCR test because you're still likely to have COVID-19 and therefore you need to stay isolated until your negative PCR result is received. Likewise, before I end, I also advise everyone to get rapid antigen test if you have COVID-19 symptoms like cough, fever, and sore throat. Don't go into a denial. This is just allergy. At the present time, if you have these symptoms, it's COVID. You want to find out, especially if you have been exposed to a close contact. If you are positive, you can get the rat. Or if you need a negative test to leave home quarantine, that's the time, day 5 after quarantine, after you've been exposed to somebody. If it's negative, then you can leave your quarantine period. I hope these simple tips can help you navigate COVID-19 testing at this present time of the Omicron surge, so you can decide right away on the best way to mitigate spreading the virus to your loved ones. Again, this is Dr. Jerry Tan. See you again soon.